Hi, thanks for coming back out to the channel. Today I'm going to swing back around to episode 5. Episode 5 was about 2 weeks ago, and we did a deep dive on statistics. I'm going to revisit that deep dive and expand on it a little bit because, as we keep on tracking through here, more and more data and more numbers are starting to show up, and we can start actually making some assessments on how this is going to impact us over the long run. Now, what I wanted to do is I wanted to marry this episode with this great and awesome at home self care treatment for depression. It's a cool 15-minute treatment that you can do on a daily basis to help boost your mood and to help even out that edgy restlessness that you're going through. The thing is, this episode's going to be a little bit too long. So I promise my next episode, I'm going to give that to you, and that's going to help you get through some of the insane, restless stress that's going on right now. So let's start out in Johns Hopkins. And we can see globally we have 3.5 million cases of coronavirus with a total of 250,000 deaths. So let's look at what's going on in the US. We have almost 1.2 million cases right now. We have 68,000 recorded deaths. What I wanted to do was understand what these 68,000 deaths are. And you'll see what I mean in a minute. I'm going to start out with I live in Washington State. I'm going to go down to King County. There it is, King County. Washington is right here. It has 459 deaths. Okay, so let's go to King County. There it is, King County. Deaths due to COVID-19, 461. These are actually deaths that are coded to COVID-19. Why is that important? I'm going to show you why that's important in a minute. I'm going to swing back to the provisional death counts on the CDC website. This website is really amazing and it changes every week. Last week, right up here at the top, and they've changed this, they basically said the pneumonia deaths are actually COVID-19 deaths. Now, that's not happening today. I'm going to show you where you find out about the pneumonia deaths. Here we go through this report. And the one thing that we have to remember is that the data, it's going to be incomplete. There's a delay that can range from 1 to 8 weeks. And I'm going to show you that on all of these cases here, COVID-19, pneumonia, and influenza, the delay is 1 to 8 weeks on these because these are all manually coded, which I didn't know. And I'll show you where we can find that out. So before we get into this too deeply, in order to figure out what's going on in this report, we have to go to technical note. Okay, here's the technical notes. And first, let's look at how lengthy the technical notes are. What used to be at the top of the provisional deaths pages now is if you get through this to the end, here's where they tell you that deaths due to COVID-19 may be misclassified as pneumonia or influenza death. There's a couple more really interesting things to learn from the technical notes. And the first is I didn't realize this. Some states report deaths on a daily basis, while others report deaths on a weekly or monthly basis. So you can't compare death counts across states. Place of death. Now, for here in this report from the CDC, the place of death is the physical location where the death occurred. Two more things that is really interesting on this report. This is a cause of death classification. Now, for those of you who have ever received an EOB or an explanation of benefit from your healthcare company, there are ICD-10 codes on those. And those ICD-10 codes, what they represent is the symptom that's being treated. Shoulder pain would be one. There's also ICD-10 codes for deaths and cause of death. Coronavirus deaths are classified as U07.1. And then we have the pneumonia deaths, and these are classified between this J12 and this J18. And the influenza and pneumonia deaths are J09 to J11. So the key thing on that, pneumonias are the J's. Last is delays in reporting. 80% of the deaths are automatically processed and coded within seconds. 20% need to be manually coded. Deaths involving certain conditions such as influenza and pneumonia, and all deaths with COVID-19 are manually coded. Let's go back to those provisional death counts and see what's going on here. Now that we kind of know what we're looking at, we have 38,000 COVID-19 deaths. We have 66,000 pneumonia deaths, and this is J12 through J18, so it doesn't include the influenza deaths. And then here they take those J12s, those pneumonia deaths, which actually show COVID-19 as a comorbidity. So 17,000 deaths there. And it starts to make more sense when we get down here to week 411. Look at that. There's 10,000 pneumonia deaths. And of those 10,000, 5,000 of them are coded with COVID-19 as a comorbidity. And so it looks like about 50% of the pneumonia deaths are going to have COVID-19 as a comorbidity. I want to look at the pneumonia deaths in a little bit more detail. And so before we do that, remember the flu view in episode 5. So let's do that again. And so I'm zipping down here to the mortality of pneumonia and influenza. And what they're showing is the percentage of deaths of pneumonia and influenza is down to 9.3%. And last week it was 13.6%. Now that they have the epidemic threshold at 6.8%, they're saying that influenza, it's not even statistically significant in the population right now. 0.2% of the tests are coming back positive for influenza. Last week it was 0.4%. So statistically, influenza is not in the population. And that is why they are saying that these pneumonia deaths that we're seeing is more likely due to COVID-19. And there's where they say it. So you had to do a lot of digging to get to this information, but now we know that the pneumonia deaths are COVID-19, and that makes sense because we're still in pandemic level deaths, but we're showing no influenza. So it can't be the influenza that's causing pneumonia. Okay, let's go back to the provisional death counts for coronavirus disease at the CDC. Let's go back to this report that we've been reviewing. And here we have it. Let's see, COVID-19 deaths, 38,000. Pneumonia deaths, 66,000. Now, this shows you how many deaths were coded with both pneumonia and COVID-19. So remember these codes here, these ICD-10 codes, J12 through J18. And then this was the COVID-19 code. So 17,000 are both coded for pneumonia and for COVID-19. This count includes that 17,000. This count includes that 17,000. So when we want to get to this total, what we're going to do is we're going to add this, and then subtract this and add in the influenza. And it should come up pretty close to this 92,000. Last time I did it, the numbers were off by like about 400. So I'm not quite sure what that's about, but the numbers were off. Now, all of that's leading me up to this part, the pneumonia deaths, coded to the J12 to J18. Let's look at these. Now, if you go back to episode 5, you're going to see this pretty much was about 3,500 all the way through here. And what we see now as the death counts are starting to roll in, on March 21st, it starts ticking up, 4,100. March 28th, 5,600. Beginning of April, we're up to 8,700 pneumonia deaths. Mid-April, we're at 10,000. Okay, so now if we look at this, this is about 27% completed in reporting. This is about 54% of all deaths have been reported. And then if we go back to this is about 75% of all deaths have been reported. And back in beginning of March, this doesn't look too bad. Look at percentage of expected deaths, 97%. And now we go forward and just 4 weeks later, percentage of expected deaths, we're already at 103%, and theoretically, this is only 54% reported. And then we climb up here and we can see we're at 122% of expected deaths. So we are seeing a lot more deaths due to COVID-19. I think here about 418, we're a little over 30% reported, and we're already at 106% of deaths. So the expected deaths are starting to increase significantly. Now, the next thing I wanted to do was look at the pneumonia counts by state. And here's where I thought, wow, what's super helpful information, because I was looking for this all over the web. And oh, I can now just scroll down and look at this. They have the pneumonia counts and the influenza counts by state. That's amazing. Let's go to Washington because we might as well look at this one because I have the most information for this one. Okay, so Washington, 531 reported deaths. And I'm going to zip up here again so you can just see this. Pneumonia deaths. And then this next column is pneumonia deaths with COVID-19, and this last column is influenza deaths. So pneumonia and COVID, influenza. Let's go back down here. Washington, total deaths 531, pneumonia 1,200. So pneumonia and COVID-19, 284. So there's still 1,000 deaths here that are just recorded as pneumonia and not COVID-19. And then this is the influenza deaths of 98. So why that's significant is 531. Remember now they're saying these pneumonia deaths are more likely now COVID-19, or they are COVID-19. Subtract out the 284, which is in both the pneumonia number and the COVID-19 number, and you still have about 900 pneumonia deaths that are not attributed to influenza because that's not happening right now. So that 900 deaths you can add into the COVID-19 deaths, and you've got about 1,400 deaths in Washington. Okay, so you guys can go out there and you can look at this. What I wanted to do is now you start understanding where the pneumonia deaths are, and that brought me to a couple things. Okay, here we are, Washington Department of Health. So this is the state of Washington. This is right now the whole state information. We have 15,000 confirmed cases, and as of today, 834 deaths. And that's a little bit different than the 531 that's reported up on the CDC website. And that's basically because these deaths happened in the last week or so. Now, here's the total number of tests that we've done. So you take this number divided into this, and you get a percent positive of 7.2%. When we went into quarantine for the state of Washington, when we went into not quarantine, but social distancing, we'll call it something fluffier. When we went into social distancing, this percent positive was starting to track up around 11%. So at that time, New York, their percent positive was 30%. And this shows the state, and the number of cases gets darker and darker. Okay, here's the thing I wanted to point out. When we looked at this 2 weeks ago, it was just these three counties that were showing dark areas. The rest of these were all this really light, nice, fluffy blue, and including this guy here. This is Scamania. And now what you can see is you can click on Scamania, or I'm sorry, Yakima. You can click on Yakima and look at this. Right now, the percent positive is 19.8%. So I went in and did a little research on what's happening in Yakima, and that is one of our big agriculture areas. And it's our agriculture food area, and I guess healthcare too. What they're saying is this is feeling the pain that all our food areas are feeling, where the workers are working really close to each other. They're considered necessary industries, so there's not much social distancing going on, not many people staying at home, and the infection is starting to grow into a horrible pandemic in this area. What this did for me was really help me reassess my idea of how safe is it to go outside, and it's not very safe. And this is another big agriculture industry, Benton County. Percent positive is 15.9%, 23.5%. Wow. In Franklin County, these are all our ag areas. And so it really starts highlighting that we really have to figure out a way to help protect and save our agriculture areas. It used to be that the industry areas, King County, the industry areas were the ones that were testing positive. And look at this, even with social distancing, King County still has 10.7% testing positive. Okay, so that was really interesting for me. I finally had enough information to make some assessments of what's going on. Now, this is just COVID-19 cases. Imagine there's another 900 pneumonia cases which are not mapped into this. And where are those guys coming from? Okay, so all of that was to get here to Georgia because Georgia's opening up their state again. And here's this is just to get a rough idea of where their numbers are. They've got about 30,000 confirmed COVID-19 cases. Into ICU, they've admitted about 1,300 people, and they have about 1,300 deaths. Their hospitalizations have been uh, about 5,500. So let's look at this. I want to remember that IMHE report that we were looking at 2 weeks ago. This is the health data. What they try to do is project where you're going with this COVID-19 and how it's going to impact your resources. Well, they've changed it a little. It used to be easier to read, and now they have more data and it's more complicated to read. One of the things that we see is the deaths per day have been going up, and one of the recommendations is that deaths per day are actually going down. And so we can see their deaths on a are increasing. And then we get down here. This is what I like to come out here to see, which was their hospital resource usage, and we're now on May 4th, and they have 8,300 beds available. Right now, they only need 1,900 beds, and the ICU beds, they have 590 available, and they need 523. So that's always been the the critical point with this COVID-19 is as soon as your ICU beds are consumed, everybody who needs to go to ICU is going to pass and perish. And then your death numbers even go up higher. So right now, Georgia's pretty close to their tipping scale. Let's go back to the provisional death counts just one more time. And remember, here we are seeing the deaths by state. And I wanted to come here because I wanted to see what's going on in Georgia. And right now, the COVID-19 deaths that have been reported to the CDC is 506. And we saw when we were at their dashboard that they have 1,300 deaths. So there's a lag going on. That's that lag that they're talking about in the manual coding. And then we can see that the pneumonia deaths, there's about 1,400 of those, and about 250 of them are both coded for pneumonia and for COVID-19. So if we take the 200, 250 or so out of here, we still end up with about 1,100 additional pneumonia deaths that need to be added back into this number. And that starts really significantly increasing the mortality rate for COVID-19 in Georgia. Instead of the 1,200 deaths, now we have 2,200 deaths. Okay, so this starts to show a little bit of how you can use these numbers. And I like looking at these charts for the state, so whatever state you're living in, to review where that infection is spreading. You can see for Georgia, Fulton County, which is the home of Atlanta, is the hardest hit. And then the suburbs around Fulton are starting to get hit with the coronavirus. And then you have some down here. Contact tracing becomes a really big issue. And we can look here at Dougherty County in Georgia. Their population is about 90,000. This has had a really significant outbreak. And where did theirs is all community transmission. Juror 0. More than 100 people were summoned to the courthouse for the highly publicized local murder trial in early March. And this was the case of the local moving company owner, Jazzy Huff, on Stand Your Ground. And one of the jurors was infected on the third day. The juror sent a note she was feeling ill. This was the start of it. And then then they have this funeral, which they think was more community transmission. And here were the funerals of Johnny Carter and Andrew Jerome Mitchell. Wow, I just find this super, super tragic. Right now, Dougherty County has more deaths linked to COVID-19 than Fulton County. Okay, so time to look at something positive. Okay, so I really wanted to look at the stats again as we keep on moving through the weeks. I find that I go back to this information years later. So when the flu mutated, I put out a couple videos here on what the data was saying, on what the research was saying on that flu and what was happening with the flu. And I find that I'm going back to that data a lot today. This is more as a document that I can go back to in the future and remember what was going on. And so one of the things was I think that 2013 pneumonia pandemic, our numbers, we were only 9%. We're way over that right now. The next episode, guys, I'm going to do something much more positive to help us get through this because every time we look at this, this is incredibly, incredibly devastating. And it just really, really starts to bring home that there's a lot of people that we know, including ourselves, that are at risk and we don't have a lot of systems in place. It takes us a long time for being such a powerful first world country. It's taken us 3 months to get data that we can actually start to look at and go, okay, here's what's happening. Well, we still need to get to testing of everybody so that we can start identifying outbreaks. We need to get outbreaks under control. So there's actually a point to doing the testing of everybody. So there's a lot of things that we need to still have in place in order for us to be able to open up the country and be able to continue working and not have to go back into lockdown. Next episode, I'm going to do something for that stress, restless depression that you might be experiencing. And I'm also going to give you another piece of information that will help you with this COVID-19 as you're living your days through this. Thanks for coming out and watching this. And until next time, I'll catch you on the other side.